The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, it is great to see you.
It's great to be here, Shay.
And I have to say, purple is a great color for you. So, and being I'm a Vikings fan, I kind of like purple anyway. So, but today we're going to talk about bioidentical hormone replacement therapy. We know that fluctuating hormones is a problem that a lot of people have, particularly as we age. But there are some things that you can do there at Living Well to help with that.
Right. Especially today, talking about what are signs and symptoms of hormonal imbalance. And I think patients sometimes just really push these things off to, it's just part of aging. I'm getting old. This is
Right.
me. But, one of the big ones is fatigue. And, a lot of times patients suffer from a large amount of fatigue, almost feeling like viral infection, like in the afternoon after they've worked all day, come home, have little energy to motivate to do the chores they need to do at home, or to play with their kids, or to keep going in the evening, and they just want to sleep. And then they try to sleep and their sleep is restless and they don't get rest
Mm-hmm.
night. Another sign of hormonal imbalance. Hot flashes in women, definitely a sign that they're moving through the change of menopause and things are starting to not work as well, and they're starting to have a difficulty regulating their body temperature. The other thing is hair loss. A lot of women come in and men come in complaining of hair loss. That can be a sign of hormonal imbalance. Acne outbreaks, again, another sign of hormonal imbalance. Foggy thinking, just not having clear, transparent thought, having to always fight for words, or never feeling like you can express yourself clearly. Those all can be signs of hormonal imbalance. And when these start to happen, they sometimes can gradually come on, or they can just start up, almost suddenly in patients. And a lot of times, currently when we evaluate patients for this, we may chalk it up to depression, and they may be told, well, you're
Right.
probably depressed, or you're stressed, or you have anxiety, which also depression and anxiety all can be stemmed from hormonal imbalance. Not always, but definitely can. And so, it's good to sit down with someone who actually will listen regarding these symptoms, and then evaluate your hormone levels and determine whether you are deficient in testosterone and estrogen. Males lose 3%, up to 3% of their testosterone every year after the age of 30. By the time they're in their mid 40s to 50s, they're severely depleted. And I will say this about males: we're seeing it more and more earlier and earlier. And I directly relate that to the diet in this country. Our diets are so polluted with so many things that are not good for you, and it is
Right.
hormonal axis. And also, there are times when we have athletes come in that have used hormones early on, used testosterone and other things in the gym early on, that really can mess with the pituitary axis. So just taking a moment to pause and say that is never okay. It is never okay to take something not prescribed by a doctor, one. And two, it's never okay to get something in the back of a gym that you think is going to help you perform better, or be stronger, or look better. That can be extremely dangerous. And that happens every day, all day long. And people need to be aware that can really mess you up in years to come, and screw up the pituitary axis and shut down the production of testosterone in men early on, which can create a lot of problems. So,
Sure.
setting and talking about these things, hormone replacement is not necessarily for everyone, as is anything in life, but it definitely should be looked at as a possibility to help with these signs and symptoms.
All right. Well, Dr. Chapman, this is great information, and I'm sure our viewers appreciate it, and we appreciate you being with us.
Thank you for having me.